Hello. This webinar will be providing you some information regarding childbirth education, specifically content around labor, delivery, and postpartum. Here are the objectives that we hope to accomplish by the end of the webinar. We will be providing information regarding warning signs during pregnancy, some of the things to watch for as you get closer and closer to labor. We will be defining preterm labor and what to look for. We will be working on describing differences between true labor and what we call warm-up labor or pre-labor. We will help outline information about the different phases of labor and stages. We will be providing interventions and options to assist with the labor process itself. We'll help describe medical procedures that you might have happen during labor or might need to happen. We'll be providing information around C-sections, elements of postpartum and transition for when you go home, and then looking at different warning signs to watch for once you go home. Some of the things to think about as you're finishing the pregnancy is to continue to make sure that you are drinking at least 8 glasses of fluid a day, consuming approximately 300 extra calories per day, and being aware of some of the physical changes that are continuing to occur as your fetus continues to grow, as the baby grows and your uterus grows. This diagram shows you in terms of how the uterus situates itself inside and how some of the maternal organs are being somewhat compromised because of the increased size of the uterus and the baby. So as a result of that, you might be experiencing heartburn, overall tiredness and fatigue. You might be experiencing some extra swelling of your feet and ankles, especially if you're on your feet for long periods of time. Just the overall size and change in your gravity, you may have a little bit more difficulty getting around because your balance is off due to the size and location of where the uterus is growing. You might notice a little bit of shortness of breath, again, because of the size of the uterus under your diaphragm. You might be experiencing a backache, leg cramps, extra urinary frequency, going to the bathroom more. As you can see where your bladder is located down below here, things are getting kind of squished more, and there's not as much size for that bladder to fill up. You might be experiencing sciatic nerve pain, hemorrhoids and constipation, carpal tunnel, which is the numbness and tingling in your hands, and then stretch marks might be continuing on your skin. If you have any of the following items, please be sure to call your healthcare provider. If you experience any bleeding from the vagina, if your fever is over 100.4 Fahrenheit or 37.7 Celsius, if you have any pain or burning when you go to the bathroom, if you start to notice sudden swelling in your face or hands, different than what you are experiencing in your legs, feet, and ankles. If you have any problems with your vision, you are starting to see little flecks or floaters is what we call it, or maybe you're experiencing recurring headaches. If you have any vomiting or diarrhea that lasts more than 24 hours. If you notice any major changes in baby's movement, baby's been very active and now all of a sudden you've noticed a decrease. If you have any kind of sudden pain in your abdomen, or if you just feel like something is wrong, please reach out and call your healthcare provider. In regards to fetal movement, during your 3rd trimester, it's a great idea to download an app that helps you keep track of your baby's kick activity, or what we call kick counts. What we want to see, the goal is to have 10 counts when you sit down and focus on it over a 2-hour period at the longest. Sometimes it doesn't take that long to get to 10. But if it takes more than 2 hours to get to 10, try waking up the baby, just kind of jiggling your abdomen a little bit, drinking some cold water. Try again to count some more. And if after that 2 hours there's nothing, then please call your healthcare provider. Preterm labor is something that we want to also make sure that you're aware of some of the signs and symptoms that could occur. If there is any kind of change in or increase in vaginal discharge, if you're feeling pelvic or lower abdominal pressure, these could all be signs that you are starting to have contractions and that the uterus is kind of trying to go into premature labor. If you have a constant low, dull backache would also be something that would be contributing to that, as well as what some people describe as mild belly cramps. And if you can measure contractions and there's more than 4 in an hour, they may feel painless or just feel like tightening. And then if your water breaks, such as a trickle of fluid or a gush of fluid, and you are not quite at your due date, you're at your 37 weeks or prior, so you're at least 3 weeks ahead of your due date, then these would be reasons why we would want you to call your healthcare provider. Reducing preterm labor risks that are listed off to the side would be just a little helpful tips to remember to go to all of your prenatal appointments so that you can keep updated with your provider on what's happening, but also that they can provide that physical exam to monitor and assess your progress. Prevent any infections potentially, including good dental hygiene, staying away from people who are sick, and then trying to reduce stress in your life. I know that sometimes can be difficult, but you think about ways that you can do that, that can also help decrease chances for preterm labor. Some of the things that you'll be watching for as labor gets close, as your body is getting ready for labor to start. Some of these things can happen as soon as a month prior to going into labor, and some of them won't happen until right when you are starting your labor process. Something called Braxton Hicks or false pre-labor contractions. What the uterus is doing is just getting itself ready for the labor process. It also helps in preparations for the cervical area, which is in the lower part of the uterus, to soften it and get it ready to open for that birth process. Lightning is an occurrence where the fetus or baby will drop down into position, so it'll get down into the lower part of your pelvis. Some women will notice this, some will not. Sometimes what they'll notice in the terms of the changes physically is that you'll maybe be able to breathe better. You won't have such shortness of breath because of the diaphragm not being pushed on anymore. But you'll notice that you're increasing the number of times that you're going to the bathroom because now the fetus, baby uterus is all sitting on top of your bladder. The release of the mucus plug is a substance that is in the lower part of the cervix that's holding the cervix together. As it releases, then it allows for the cervix to get started with that softening or what we call ripening. And it is a precursor or pre-labor sign. Sometimes women will feel a surge of energy or nesting, and that just means that their body is getting themselves ready for this wonderful experience. But final preparations are also something to think about in terms of being prepared for the whole process. You might experience weight loss of 1 to 3 pounds. You might also notice an increased backache, again, just positioning and size. And then the other thing that sometimes occurs really close to when you would be going through the beginning stages of labor is that you might experience some diarrhea. Here is kind of a chart that helps distinguish the differences between true and what we call warm-up labor or warm-up contractions. True labor contractions will eventually cause the cervix to what we call thin and then open up. And over time, these contractions will get longer, closer, and stronger together. And activity will actually make them stronger when you're trying to change positions, change what you're doing. It will actually make things usually go a little bit faster. With warm-up contractions or pre-labor contractions, activity can sometimes make these the contractions that you're feeling go away, and they will not cause any change in your cervix. The 4 P's of labor, when we refer to this, we talk about the passageway, the passenger, the powers, and the psyche. The passageway is what you are feeling in the pelvic area. So it's what's going on there to allow for the baby to fit through. The passenger, of course, is the baby. The powers are the contractions that are allowing for the baby to fit through the passageway or your pelvis. And then the psyche is how are you doing mentally in preparation, but also in terms of your ability to cope as you're going through the labor process. Here is a diagram that's outlining, showing you the pelvic area and how the baby will fit through there. Oftentimes the baby will actually be at a little bit of an angle and it won't necessarily be coming right straight through as this diagram is showing you. But what we want to make sure is happening is that that area is large enough for the baby to fit through. Here is a diagram illustrating how the baby will fit through the area around the pelvis, the passageway. Here is showing you a couple of different angles of how babies will get themselves positioned within that passageway. One is called anterior and the other one is called posterior. The anterior means that the baby's head is situated so that the back part of the baby's head is at the front part of mom. The posterior is showing you that the back of baby's head is also aligned with mom's back. In those types of situations, that is something that's a little bit more difficult for the passenger, the baby, to fit through the passageway. Size-wise, it's easier for the baby to fit through in the anterior position. And if you were to have a baby in that posterior position, we can sometimes do different position changes for your baby to rotate as we are getting that baby ready to come through the birth canal. The powers refer to our contractions that we have. The contractions are a release of hormones called oxytocin that provides strength and contractibility to the muscles in your uterus so that it can force the mechanism to bring that baby down through the passageway, the birth canal, to the delivery. And again, like I said, the psyche is your mental ability to cope depending upon the pain and where you're at in the process and how much information that you are aware of that could be going on with your whole process of labor. This slide is showing you what we call a fear, tension, pain cycle. And the arrows are showing you a continuum. And what we want to try to do during labor is to break that continuum with relaxation techniques, breathing techniques, focusing on pain medication or pain management so that you don't have an excess and an increase in having this cycle continue throughout the process of labor. And so if we can find a way to help you or you can help with your relaxation techniques, this can help as far as coping and help with your overall psyche for labor. This slide is showing you how we would time contractions. It is showing you a contraction itself, which is represented by the orange mound that you see there incorporated within those boxes and lines. It is showing you a duration of 1 minute, and a duration means that we look at it from the beginning of the contraction to the end. The frequency then is illustrated with one contraction to the next, and we would measure that from the start of one to the start of the next. This is something that will be important to you when you're at home trying to figure out when it's time for you then to come on into the hospital to have your baby. And we have a slide that will outline that here shortly. But just remember that duration is the beginning to end of a contraction. Frequency is beginning of one to the beginning of the next. And there is an app that's available if you're interested in it. It's called imedicalapp.com that helps with timing of contractions. We aren't really sure what triggers the onset of your labor. Sometimes the theories involve the shifting in hormones, and sometimes as a result of that, they believe that there could be some trigger that the baby does that actually institutes the onset, but we really don't know the true cause. Most women will experience the onset of labor by having contractions. Approximately 10% of women will begin labor when the bag of water breaks. This could happen as a trickle, so just a slow leak, or a large gush of fluid that would actually be no mistaking that you have ruptured membranes. If you feel that you have this trickle of fluid and you're not sure if it's urine leaking or if it is amniotic fluid, please don't hesitate to call your healthcare provider to ask them questions about that, or possibly come in to be checked, double checked, and make sure that it is truly fluid or not from the amniotic sac. The color of the fluid is usually clear, but sometimes can have a little bit of a greenish tint to it. There shouldn't really be a distinctive odor. The amount is something that we look for or talk about, and then what time is this happening is going to be important. So those 4 elements are things that the nurses will ask you when you arrive at the hospital in regards to what color was it, was there any odor, how much was there, and what time did it happen. Your healthcare provider would also be potentially asking you those questions if you called them to try to problem solve and figure out whether or not your water broke or not. The stages of labor are broken down into 4 stages. In the first stage, that's the labor part. This is where your cervix will open and completely thin itself so that the baby can fit through. The second stage involves pushing and the birth of your baby. The third stage is the delivery of the placenta or the afterbirth. And the fourth stage is recovery and initiation of breastfeeding, if that is your choice. So when we talk about effacement, what that means is that we want the cervix to thin. And what you see here in these 2 diagrams are a cervix that is not effaced. So that reddened area that's in the circle, it's a very thick area versus the picture beside it. If you look inside the circle, you'll see that it's much thinner. So that's the difference between an effacement and not being effaced. And then the dilation is actually the opening of that area, and it will start at 0 when it's not open at all, and it will end at 10 centimeters. So if you look at those 2 circles again, you can see that this one on the not effaced is also not open hardly at all. There's no opening here. And then this one here, you'll see that not only is there thinning, but then there's a little bit of an opening starting to happen. The pelvic station is important to note because this is telling us how close the baby is to the actual delivery or to the opening of the vagina. And so we use those reference points that you see there to help us determine kind of a way in which to compare that the baby's getting lower and lower and getting closer and closer to delivery. So we'll use positive numbers as it gets closer. So now let's talk a little bit about those stages. And with first stage, which is our labor process, we will break that one down into 3 different phases. The first one is called early labor. When you start having contractions in early labor, they're going to be fairly mild and can be very irregular, sometimes 5 minutes apart, sometimes 30 minutes apart. They'll just kind of go back and forth as the body's trying to get things going. And they may be fairly short, only about 30 to 45 seconds in duration. During this time frame, your cervix, if it hasn't started to dilate, would start that dilation process, and this will end at approximately 6 centimeters. During this time frame, overall, women feel very excited and happy that labor is finally starting, but they also have some anxiety because they're not really sure exactly what's going to happen and want to make sure that they're doing the right things and making sure that they get to the hospital. And so there'll be a lot of questions that might be coming up as you're going through this, and don't hesitate to be in contact with your healthcare provider to kind of determine when's the best time to come in. Some of the activities that you'll want to do to kind of pass the time, because this will potentially take up to 12 hours for you to get through this process. It can be anywhere from 6 to 12 hours, depending upon kind of where your body got started. Did you have some dilation happening already prior to this actual event starting with contractions? Or are you really starting from scratch? So come up with some things to help keep yourself busy. If you can, try to sleep, try to rest. If this is happening in the middle of the night, especially, try to just keep getting some sleep if you can. That way, you're more rested when it comes time for the parts of labor that you will need your strength and your endurance for. Some of the diversions that you might consider would be music, watching TV, movies, playing cards, maybe walking, taking a shower or a bath. You can continue to have some soft foods, things that aren't real upsetting to the stomach. You can drink fluids. And then again, like we said, if your water broke, you want to make sure that you're in contact with your caregiver because you may need to come right into the hospital then. So the general rule, and of course you'll want to follow your healthcare provider's instructions on this because some people might have different things going on where they want you to come in at a different time. But generally, it's when your contractions are 5 minutes apart, they're lasting about 60 seconds each, and that's been going on consistently for an hour. If, however, you've been given different instructions, please follow your healthcare provider's instructions. Or if you have any of the following items, make sure that you're going in sooner. So if you're starting to vomit with contractions, you feel any kind of rectal pressure, like you're going to have a bowel movement, if you are not able to walk or talk through contractions, if you think your membranes or bag of waters has ruptured and broken and you've got leaking fluid, if there's any kind of bleeding, you want to make sure that you're coming in. If you have tested positive for group B strep, you will need antibiotics, and so that is sometimes a need to come in sooner. If you live far away from the hospital and you've worked on a plan with your provider about that, and if you have had other children and you progress quickly, you're going to want to come in sooner. The active part of labor, or what we call this kind of that second phase, we call that active labor. This is where your contractions are going to be more closer together. So they'll be about every 3 to 5 minutes, definitely lasting longer and definitely stronger. The cervix will dilate between 6 and 8 centimeters. And emotionally, you're pretty serious and focused on what's happening. As you can imagine, the contractions are going to be stronger and they'll be closer together, so there won't be as much of a break in between. Some of the other things that you might note and notice during this period is that you might see what we call show, bloody show, and that's because the cervix is dilating and the little blood vessels are bursting and mixing with the discharge that's normal. So this is a normal phenomenon that tells us that labor is progressing. But if it's bright red bleeding, that's not considered normal. And if your bag of waters did not break during early labor, most of the time it will happen here because the contractions are stronger. This period is on average 3 to 5 hours. Please keep in mind that these are generalities. They're not black and white. We do see patients that will have shorter periods of time and also longer periods of time. The next part of your labor involves transition. Transition is the very last step before you start pushing and bringing the baby into the world. These contractions are going to be much stronger, closer together, and longer. So it almost looks, based on that description, that they might be like sitting on top of one another, happening all the time. And sometimes it will feel that way. There should be a little bit of a break in between so that you have a chance to recover as well as the baby to recover. Your dilation will finish. It will go from 8 to 10 centimeters. You will potentially feel very frustrated because you just don't want this to keep going. You're ready to be done. You're more dependent on others. They will help coach you through this. Some of the physical symptoms that you might be feeling during this part of your labor is that you might get chills, you might be shaking from exhaustion, you might notice more with some nausea issues, and you'll feel more pressure in the pelvis and the rectal area. The really nice thing about this is it is a much shorter time frame. Sometimes it's as short as 30 minutes and sometimes it can be about 2 hours. So it does finish up fairly quickly. And then once you can get through this, at this second stage, and the second stage is going to be a little bit easier for you because you will be able to actively participate in the process of bringing the baby to the final steps through the birth canal to the birth. So during second stage, your contractions will space out slightly. They'll still remain strong, but they'll give you a little bit of break in between because you will be actively pushing during this part. Most women are feeling some sense of exhaustion. Compare doing labor to running a marathon and how you feel at the end. So it's a little bit more of an adrenaline rush here because you know what the end is in sight. A lot of women are feeling a little bit more relieved because they get to have more of an active participation in this process. The active pushing second stage can be anywhere from about 20 minutes to 3 hours. It really just depends on how low the baby is in your pelvis as to how long it will take to push the baby through. And then, of course, the end of the second stage is the birth of your baby. The third stage is going to happen about 5 to 20 minutes after you've given birth. And so you might not even be aware of anything that's happening here because you will be with your baby and the baby will be close to your chest area doing skin to skin. And we'll talk about that more here in a minute. But this part here is the rest of the birth elements. So whatever is left inside the uterus, umbilical cord and placenta will need to deliver. And again, that takes anywhere from 5 to 20 minutes. You might notice some contractions. They'll be much milder than they were before, so that the uterus can release the placenta. And then you will also feel that the nurse and provider are doing a massage to your fundus, which is the top part of your uterus. This massaging will help clamp those vessels down and decrease the chances of hemorrhage. And then your fourth stage will be for the first couple of hours after birth. During this time frame, your uterus will continue to contract and shrink, so you will feel some what we call after pains. But this will be a great period of time for you to start bonding with your new baby. You will be doing skin to skin as long as you're feeling up to it and baby's doing okay. And these two pictures illustrate what that looks like. So we will have baby directly connected to you as far as being skin to skin, so there's no barriers in between. And then we can put a blanket over the top of the baby to keep the baby warm that way. But your skin will also help with keeping that baby warm. So we'll pause now. We'll go back to the wonderful process that you'll be doing with Skin to Skin and Sacred Hour and getting to know your baby in a little bit further down the road here in another presentation called New Parent webinar that you'll have access to. But for now, we're going to focus on some of the mechanisms and techniques to help you cope with the whole process of labor. The first thing we're going to talk about is breathing. When we're talking about breathing, a couple of things to remember is that you will want to be doing what we call cleansing breaths through any of the exercises that you will do with any kind of breathing to help you cope with your labor process. The cleansing breath helps mentally prepare you for what's ahead with your contraction. And then at the very end, it helps you mentally get rid of any of that pain that was left from the contraction that you just finished. One of the things in terms of the technique is that you want to be either breathing in and out your nose or your mouth or a combination. So that part is not specific, but you do want to make sure that you include this cleansing breath. And your breathing pattern will vary depending upon the amount of pain that you're experiencing. So as your contractions are peaking, they're getting stronger and stronger, you'll want to speed your breathing up slightly to help you as a distraction throughout the process of that peak, where it's the strongest part of the contraction. But then as soon as that contraction is starting to go away, you need to make sure that you're slowing your breathing down so that you then can go back into a relaxation state. And also, it will help keep you from hyperventilating. If you maintained a very quick, rapid breathing pattern, even when you're not feeling the peak of that contraction and the pain of that contraction, you have a highly likely chance of getting into a situation where you're hyperventilating. So some of the things to watch for there, if you feel like you're starting to get lightheaded, any dizziness, maybe there's some numbness starting around your mouth, or even your fingers are tingling, that is a good sign that tells you that you're hyperventilating and we need to have you slow down, take some really deep breaths, and then exhale really slowly so that you're preventing it, but also regaining the balance between the oxygen and the carbon dioxide. Hyperventilation symptoms are a result of too much too much oxygen. And so we're trying to give you a chance to build up the carbon dioxide to create that balance again. Sometimes we'll have you breathe in a mask or like you can cup your hands so that you're kind of rebreathing the air, and that helps to create that balance again as well. So breathing is a great way to help you with some of that distraction and some of that coping to help you get through those contractions, especially if you are interested in getting some sort of a pain medicine, but you're not quite there yet as far as the progress of your labor. And so this can help you get through that little bit of time prior to getting your medication. Some of the relaxation techniques that will also kind of go hand in hand with breathing that are very helpful for some women is, first of all, look at your environment. Try to create an environment that is more relaxed because your lighting is dim. There's not a lot of extra sounds, maybe just some soft music in the background. Make sure that the temperature feels good for you. Smells can sometimes be very sensitive, but there's also aromatherapy that can be beneficial. So check with your nurses if that is something you're interested in. And then if there's something familiar that you can use as kind of a focal point or distraction to watch or look at during your labor, that can also be a great way to help with relaxation, and it provides that power of mind over body. Massage can be an awesome tool as well to help relax, especially if you're having issues with back pain. Hydrotherapy, such as tubs or showers, if your conditions allow, will also be a great way to help with relaxation. Again, that will be something that you're going to want to visit with your physician, your healthcare provider, if you are interested, and then also your nurse when you arrive. Some of our facilities have tubs that you can use. Others have limited numbers. And so you do also want to check with your hospital that you're going to deliver at if this is something that you're interested in. Here are some effective positions that help depending upon what's happening with your labor, how strong the contractions are, how close they are, what's the baby's position as it's coming down through the pelvis. And so these would be also some of those types of positions that I talked about if you have a baby that's in that posterior position. So baby's head is kind of coming along mom's back, the back of the head. Sometimes this will help with rotation as well. So sitting on a birthing ball or using it to lean into, or putting a what we call a peanut ball, which is another version of a birthing ball, in between your legs are all very effective ways. Not only does it help with baby's descent, but it also does help in terms of different ways for pain relief, especially if you're having a lot of back issues. And then the hands and knees feature that she is showing there, she has a pillow wrapped around inside of her that she's tucked into. And that can also help with some of those back labor issues that some women experience. You can also do that with a birthing ball or a peanut ball once you get into the hospital. Or if you have one at home, you can certainly try that as well. The peanut ball is actually shaped sort of like a peanut. It has a kind of a groove in the middle of it. So that's where the legs will rest that help in terms of that position. Some other things to think about when it comes to back labor is what we call counter pressure. So as you're having a contraction, if you have someone massaging or just pushing on that lower back area, that can create counter pressure and it relieves some of that pain. Heat and cold packs can also be a help and a benefit. And then the picture that you see on the bottom in the middle, they're doing what's called a double hip squeeze. The nurse in the blue is holding on to her hips and doing something similar to counter pressure. This counter pressure, by doing that, allows for that same phenomenon where you're feeling the contraction, and during that contraction, they are pushing and creating kind of a squeeze. So they're pushing inward to help with some of that pain sensation that you're having with that back labor. Some women will have longer labors than others. So if at all possible, try to rest when you can, change positions frequently. We usually try to think about changing positions about every 30 to 45 minutes because that not only helps you from a comfort level, but it can also help from a progress. So it keeps things moving forward. Sometimes we need to change your atmosphere or your environment because it is kind of becoming, you're desensitized or more sensitive to it. We want to keep you hydrated and nourished during labor. We do give you an IV, and then we'll allow for certain kinds of fluids or possibly a light snack depending upon that early part of labor. Really, once you get into active and transition, then we don't really give you food, but you might still be able to have some things to drink. Your support people are going to be important. Sometimes they need to take a little break, step out for a little bit, and then come back. And then again, just experimenting with different techniques to help you get through. Whether you were doing some massage and it was good for a while and then it really wasn't, maybe go back to that. Maybe getting up and walking around again might be a good change, things like that. If you haven't tried the bath or the shower, that might even also be a benefit. Labor partners will be important to try to keep some of that toolbox available, some of those items and those ideas of what you can do to try to help them keep going through this. You also want to rest when you can, keep yourself nourished. You're going to be a great liaison between the medical staff and mom, the patient. And if things start to get intense and you don't feel like you're doing what you need to be doing or that it's working, please don't take things personally because it is a very intense situation that mom wants to get through and you're there to help her. Here are some items for you to think about in terms of packing your bag for the hospital. You'll want a blanket for the baby's trip home, and that will be a blanket that will go over the car seat. It won't be a blanket that the baby will be wrapped in, especially if the temperature is colder. For you during your labor process, maybe some music or videos or focal points. You'll want to bring snacks for your birth for the partner that's helping support you. We do have vending machines and things like that as well, but if there are certain things that you want, it's a good idea to try to remember that. Your baby book and camera, your phone that takes pictures, things like that will be important. Aromatherapy, I mentioned a little bit ago. If that is something that you're interested in, please visit with your healthcare provider and the nursing staff to make sure that it's okay. And then massage aids are things like tennis balls. That's just showing you a rolling pin, lotion. All those kinds of things are going to be important if you're going to be doing this for a period of time. It helps your hands not get so tired. And then comfortable clothes. When you're in labor, you'll be wearing a hospital gown, but then after the delivery, if you have nightgown or robe or slippers or socks that you want to wear, it shouldn't be a problem. Some women want to make sure that they have something in place called a birth plan where it expresses your desires and wishes for what you want to happen. But keep in mind that if you do want to put something like this together, that it does have flexibility to it because things can change. And sometimes we can't honor those requests that are going on or that you want to happen. You'll definitely want to discuss this birth plan with your healthcare provider so that they're aware of what your wishes are and what you want to try to do. And then that way, too, you guys can talk about the different questions, concerns that you might have. The things that would be part of that birth plan could be support, medications, different types of positions and comfort measures that you want to try. What are you planning on doing as far as breastfeeding goes? And then if there's things for the newborn and circumcision. And the next slide shows you an example of a birth plan you could use. And if you are interested in requesting that, there will be some contact information at the end of this presentation that you can reach out to us, and we'll be glad to provide this to you. So it talks about what you want for an environment. Do you want dim lights, different kinds of music that you would provide? Do you want the TV on or off? What visitor-wise, what you want? Hydration, clear liquids are things that'll be appropriate. And then, like I said, we'll start an IV, but if it's something that you're really wishing on something different, again, that's something you'll talk to your provider about. This looks at monitoring options for the baby and your contractions, pain relief options, as well as pain interventions such as medications or other non-pharmacological things, things like position and relaxation and water, maybe a shower, things like that. Pushing is also listed on there as kind of what you're looking at. Perinatal care, what as that opening gets larger, what are some things that you've talked to your healthcare provider about? And then baby care is listed there in terms of feeding, circumcision, cord cutting, things like that. So again, like I said, if you're interested in wanting to fill something like this out, please reach out to us through the contact information you'll find at the end of this presentation. Induction of labor is where a medication or other type of procedure would actually start your labor. We don't normally do this unless there's a medical reason to do it. A couple of examples would be that your pregnancy has gone too far past your due date. Maybe mom has some health risks, such as blood pressure that's getting a little bit worse, diabetes that's not being controlled or is just difficulty to control. If the baby is also showing signs of some things, such as maybe it's not growing as much as it should, those kinds of things can happen. And so that's another reason why it's important for you to be going into your prenatal visits to see your provider so that they can track this information and assess you for your progress. And so if things do start to arise that are putting your health or baby's health at risk, then the doctor might consult with you for doing something like an induction of labor. Otherwise, our goal is to try to go the full 40. Augmentation of labor is a little different. This is where you have actually started the labor process, but now things have kind of slowed down. So you were having contractions, you were starting to dilate great, and then all of a sudden things just kind of stalled, aren't making progress anymore. So augmentation would be a way in which you would try to get things going again. And there's different ways that you can do that. Sometimes they will start some medication for you, and sometimes they'll maybe break the bag of waters for you so that that can keep things moving forward. But you yourself can also help with this in terms of changing positions and maybe getting up and walking around. Again, that was part of when we talked about interventions to help with long labors. This would also be one of those kinds of situations that might happen. Some of the other medical things that might happen during your labor process, these would be a lot of the methods that we would do for either an induction or an augmentation. So the first picture shows you stripping of membranes. That might occur during a vaginal check when you're in the doctor's office. They might be checking your cervix to see how far dilated things are, and then checking that membrane status. The cervical ripening agent would be something that would be inserted into the vagina to help to soften and ripen the cervix to get it started in its labor process. The Foley catheter picture there that you see on the top right side, that is what we call a mechanical dilator, and it will physically open up the cervix because of the size of the catheter itself, the balloon that's part of it. The amniotomy is where the doctor goes in and does a rupture of the bag of waters, and that is what we call an amni hook. It has a little tiny hook on the end that they can just kind of snag that bag of waters, and then the fluid will then flow out after that. And then the last picture on the bottom is the Pitocin bag. So that would be the artificial oxytocin that we can give you to help either start your labor process or augment it if things have slowed down. And it is similar to the natural hormone that your own body produces to help start that whole labor process. Electronic fetal monitoring, this is showing you external fetal monitoring, is one of the tools that helps us in providing an assessment of what's going on with your baby, as well as your contractions. In the top left-hand picture, it shows you two belts. One is on the lower part of her abdomen, that's pink, represented with that pink belt. That one is a ultrasound device that is tracking the baby's heart rate. And then the blue belt has the sensor for your contractions. And that's usually placed up around the top part of your uterus, or what we call the fundus. Those two devices help give us a readout of your contraction patterns and your baby's heart rate. So the picture on the right-hand side of this slide shows you what that will look like as it's printing out of the machine. So the heart rate is on the left-hand side of this paper, and the contractions are on the right-hand side of this paper. And the numbers that you see on the device represent different things that are going on. The 154 would be the baby. The 74 is actually the contraction number, and it looks like the mom is actually having a contraction at that point. And then the numbers inside the electronic screen represent mom's vital signs. There is also another type of monitor that we can use externally that allows mom to be up and more mobile. It's a wireless monitor, and there are certain restrictions that go with that. So if that is something that you want, depending upon the condition, you might be able to get up and walk around in the hallway versus just in your room. Internal monitoring is a way in which we can get a better or closer track of baby's heart rate and your contractions. We have the scalp electrode and we have the internal pressure catheter. This diagram shows you both of them in place. We would only use those in times where we need to have a better assessment of what's going on. The scalp electrode measures the baby's actual cardiac activity through a translation of what we would see on an EKG monitor, and it translates into a heart rate on our screen and on the paper. And then the internal pressure catheter has a device that actually measures the strength of your contractions. So sometimes when we would have to use the internal pressure catheter would be for situations where we don't feel, or you don't feel, or things aren't progressing from a contraction standpoint. We can evaluate the strength with this device to see if we need to provide more medication or other means to help to stimulate the labor and augment it to make things move along for you. Some of the other medical interventions that you might experience. So we talked about IV fluids. These help with hydration. We can also provide other medications through the IV once it's started. And one of those would potentially be analgesics if this is your desire to have some sort of IV pain medicine. It takes the edge off, sometimes helps you cope better with what's going on with your contractions, but it will not take the pain completely away. Most of the time, if you're requesting it, we can give it to you soon after that. It does provide that fast relief because it goes right into your IV, which goes into the bloodstream. It will not numb muscles, so you'll be able to be mobile once the drug has worn off. Some of the disadvantages, like I said, it will only take the edge off. It will not take the pain away. Sometimes causes drowsiness, itching, some nausea, sometimes a little disorientation. It will slow your breathing down possibly or lower your blood pressure a little bit. And if we give it to you too close to delivery, it can sometimes make the baby sleepy. It will have kind of the same effects on the baby as it will have on you. Another option for pain management would be an epidural. The epidural will be administered by the anesthesiologist or a nurse anesthetist in your institution that you'll be delivering. It is considered what we call a regional anesthetic, so it will numb areas, and the area in which it will numb is from the uterus, abdomen, lower back, and down. You will generally still feel pressure associated with contractions, especially when the baby gets closer and closer to the opening of your vagina inside the pelvis. It will not take that pain away, but it's more of a pressure sensation. So once you ask for an epidural, the preparation itself can take anywhere from 15 to 30 minutes to get everything ready and get you ready. And then when anesthesia shows up in the room to administer the medicine, it will take about 15 minutes for them to place the epidural, the catheter, and give you the test dose to help see how things are working. This diagram, this picture here that you see, the patient is sitting up and you'll have the anesthesiologist behind her placing the catheter and the medicine. And then you have the nurse standing there in front of her helping to support the patient through the process. One thing to consider and to keep in mind is during this time frame of that 15 minutes, you will be going through some contractions during this time frame. So the nurse can be there to help support you and provide you some coaching as you're trying to get through that process of getting that epidural in place. It does have very effective pain relief. It does allow for you to get some rest, regain some energy as you're getting to the final parts of labor. It won't affect your mental state, so you'll feel sleepy, but you won't feel that grogginess or sometimes that kind of not confusion, but just some of that fuzziness. Disadvantages, it may offer what we call incomplete areas of relief. So it may be sort of a patchy relief. So one side might be more effective in terms of pain management than the other side, so left side versus right side. So we just have to keep an eye on that as you're in that first 30 minutes after epidural to see how things are going. And then after that, we want to continue to change you from side to side because you will have a continuous medication going through there to help with that pain management. And so we want to make sure that it doesn't end up with like a one-sided block is what we call that. It may lower your blood pressure slightly, and it may then, as a result of that, cause the baby's heart rate to drop for a very short period of time. But we do have interventions that will be watching you very closely to make sure that that doesn't happen, or if it does, that we can fix it very quickly. Sometimes women will have some cases of shivering, or they may develop a little bit of a fever as labor progresses. Some women will experience some itching and or some nausea. The picture there shows you the epidural needle and the catheter. So the needle is the grayish area and the catheter is the pink area. So what the physician will do, or the anesthesia person will do, is they will insert the needle into that location. It's the epidural space right before the spinal space. And once the needle is there and they know they're in the right spot, then they will take this catheter and thread it through there. And that is where your medication then will be administered for the duration of your labor. Sometimes epidurals will slow things down, and sometimes it will affect your ability to push effectively. So we will watch those things and sometimes need to adjust the rate. In second stage, when you're pushing and getting close to delivery, sometimes the doctor may need to use one of these devices. The forceps are illustrated in the picture on the left. The vacuum extractor is illustrated on the right. What these will do is help provide momentum to bring the baby down through the birth canal. Situations where this might happen would be if you are just completely exhausted and can't push effectively anymore, or if we're in a situation where we want to get this baby born faster than the progress that you're making currently. As the baby comes through the birth canal, the pressure that you're feeling, you'll be pushing with that pressure, and then the doctor or midwife, your healthcare provider, will be using these devices to create extra momentum. As a result of that, after the baby is born, you might see some redness in the area where those items were placed on the baby's head. There also might be a little bit of bruising, and there also might be the chance that you might have a tear in the vagina or the perineal area that would need to be repaired. So the doctor will, or midwife will, look at that really closely after the baby is born. This picture illustrates the episiotomy. This is not a routine procedure. The doctor or midwife will only do this if the vaginal opening needs to be larger. And then after the baby is born, then they will make the necessary repairs. Now we are going to turn our focus to C-sections. Up to this point, we have been mentioning things that would happen in a vaginal delivery, and now we're going to talk a little bit about C-section deliveries. There are certain conditions that would require a planned C-section where you would know ahead of time and they would schedule the time for your surgery date. Some of those conditions are as follows. We would have potentially breech babies that would go through a C-section, and that is the top illustration there where you see the baby's bottom is coming first. So a breech presentation is anything but head coming first. The transverse baby is the picture to the right. That is a baby that's laying sideways. Placenta previa would be another reason for a planned C-section, and that is the illustration on the bottom. And what that is showing is the placenta has implanted itself in the lower segment of the uterus, which would prevent the baby from fitting through without the placenta having to go first. And so the previa, we would be doing a C-section. If we have multiples, so if there's 2 or more babies, a lot of times we will schedule C-sections because of positions, such as the breech or transverse. If there are other certain kinds of medical conditions of the baby or the mom that the providers will have talked to you about, and then some moms will have C-sections for subsequent deliveries if they've had one before. An unplanned C-section would be a situation where we're seeing what we call abnormal fetal heart rate. Baby is not tolerating labor anymore, and so we need to deliver the baby very quickly because of those abnormalities. Another reason would be if your labor is not progressing. Some women will get to a certain point, but they won't be able to progress any further. It isn't any fault of theirs. It's just the way that things happened and lined up for this labor. Even after trying different interventions, such as starting Pitocin, some women just aren't able to dilate. Babies sometimes will get themselves in a position where it will be very difficult for them to deliver vaginally. When we talked about positions, anterior and posterior, sometimes if babies are in a posterior position down low in the pelvis, we aren't able to get them to rotate, then we might have to do an unplanned C-section. Or sometimes we have babies that just won't fit into the pelvis because maybe their size is too big, their head's too big, things like that. Then the other type of C-section would be what we call an emergency C-section. This is where we would have to have things go very, very quickly. These types of emergencies only occur in about 1% of all births. A cord prolapse would be after membranes are ruptured, that the cord would come down in front of the head before the baby's head was engaged in the pelvis, so it wasn't down low enough. That is the picture that you're seeing right there. So the cord has slipped past the head. That's causing pressure on the cord, which is not going to be a good situation for the baby if it were to sustain and keep going in that labor process. So that's why it's safer to deliver them by C-section. A placental abruption is when the placenta separates prematurely away from the wall of the uterus. That will cause bright red, painful bleeding. And so we would want to get you delivered very quickly because the placenta is the baby's lifeline. And once that comes off of the wall of the uterus, it's not going to get what it needs. A uterine rupture is where the uterus would actually sever or tear somewhere. Things that can happen with that would be if there's been some sort of trauma or if there's issues with the maybe a patient that's trying to deliver vaginally and the uterus isn't tolerating things. If there's too much contractility, it can rupture. So we watch that very closely. And then again, if the baby is showing us signs of distress with the heart rate. The C-section surgery, your incision would be what we call a transverse or bikini. It's the location that kind of gives it the name bikini. So it's down low on your abdomen. The anesthesia that we use is either epidural or spinal. It would be a single dose rather than through that catheter that I showed you the picture of before, where it's a continuous infusion. So this would only be for that one-time single dose to get you through surgery. Now, if you've been in labor and it's been determined that you have the need for a C-section and you've had an epidural for your labor, oftentimes they can continue to use that same medication, that same method for pain relief. In situations where we have to do an emergency C-section, we would use that existing epidural if you were laboring. If not, then we would use the general anesthesia, which is a mechanism in which you would be under that anesthesia and you would not be awake for the procedure itself. After your C-section, there might be a few challenges that we'll work with you on to help you cope and adapt to the positions for breastfeeding or the movement because you will be recovering from surgery. And so we want to keep that in mind in regards to supporting the incision so there aren't any complications there. And sometimes the pain associated with that incision, we might need to place the baby in a different position rather than laying the baby right straight on top of your abdomen where the incision is, at least for the first few days. If you have a vaginal delivery, you'll spend approximately 1 to 2 days in the hospital after the delivery has happened. If you have a C-section, you will spend approximately 3 to 4 days in the hospital before you go home. Some of the things to think about in the postpartum phase as you're adjusting to going back to pre-pregnancy, you will have the uterus contracting and going back to its original size. And so as it does that, you will notice after pains. They will be similar to menstrual cramps, sometimes a little bit stronger. But what we'll be doing to help with that involution, you'll see right there in the picture, is that we'll be kind of touching and finding your uterus and massaging it to help keep it firm and to help it contract. Your lochia, which is the bleeding, it's not the same as a period. It'll start off the heaviest in the first hours after birth, and then it will start to slow down. You'll want to use pads to capture the bleeding, not tampons. And you'll notice that the color will change. It will start off as red, and it will eventually get to a brown color. The lochia will go from a reddish to a brownish to a whitish color. And that will take up to 4 to 6 weeks postpartum. The soreness that you'll feel in the pelvic floor can be relieved with either ice packs within the first 24 hours, and then after that, warm water over the area, such as from the shower or from a warm bath. Kegel exercises will help increase circulation, and then numbing spray or witch hazel pads, such as Tux, can help with kind of a soothing feeling for that soreness as well. Sometimes it's common for women to have kind of a mix of emotions as they're adjusting back to their pre-pregnancy state. Sometimes it'll be a mix of happiness and sadness, but all of this is a result of the shifting hormones. Some of the things that you would experience if you're having what we call baby blues, they feel mood changes, so those mood swings of happy and sad, maybe overall sadness or crying, maybe some anxiety, lack of concentration, or feeling overwhelmed. These are all very normal things that can occur. They don't have to occur, but sometimes they will. If you do start to feel these, talk about your feelings, try to take care of yourself, have someone help with some of your daily needs that need to be done. And then if they last longer than 3 weeks, make sure that you're calling your healthcare provider. If it goes beyond that and you get into what we call postpartum mood disorders, things that will happen is that you'll feel like there's excessive worrying and anxiety or persistent weepiness or sadness. You might have the inability to sleep even when you're exhausted. You want to lay down and go to sleep, but you just can't. You might feel like you're having trouble concentrating, having a loss of interest in different activities that you used to enjoy. If women sometimes will have changes in their appetite. If you have thoughts of harming yourself or hallucinations, please make sure that you are seeking medical help right away. If you've ever experienced depression in the past, you might be at greater risk of having it happen again. So making sure that your healthcare team understands that you've been through that so they can help with some of those triggers or help some of the symptoms that you might be experiencing. And also keep in mind that dads, partners can also get the blues or depression. While you're in the hospital, these are the things that we are going to be looking for to indicate that it's safe for you and the baby to go home from the hospital. If your pain level is under control, mom, if you're not having any difficulty going to the bathroom, urinating, or peeing, if your vaginal discharge, so what we call the lochia, is stable and that there's not an increased amount, and that you're able to be mobile and walk on your own. For the newborn, things that we watch for to say that it's safe for them for discharge is, are they feeding effectively? Are they appropriately voiding and stooling? Is their heart rate, respiratory rate, and temperature stable? And have we completed all of the necessary testing that we do on newborns prior to discharge? Uh, then those would be things that we would look for that would say that it's safe for both mom and baby to go home. After your discharge, if you have any of these things going on, mom, then you are going to want to call your healthcare provider. In our newborn PowerPoint that you'll have access to, we will outline those things that you would call the baby's doctor for once you went home. So these would be indications for mom to call their healthcare provider if you experience a fever over 100.4 Fahrenheit or 38 degrees Celsius, if you have foul smelling discharge coming out of your vagina, if you have any kind of increased uterine pain, any heavy bleeding, so it was fine in the hospital, it was starting to slow down, and now all of a sudden it is getting worse. If there's any pain or burning when you're going to the bathroom, if you feel any lumps or hard areas or pain in your breast, if there's any redness, tenderness, or painful areas in your leg, especially the calf area, or if there is any other concerns about your health, and the other items that we mentioned earlier in regards to some of those feelings that might be leading down to postpartum depression. Any of those items would be warranted for you to call your healthcare provider. When you leave the hospital, this is a magnet that we provide for you that helps visualize some of the things that would be very important for you to seek medical help for. And we use the acronym Postbirth. So the items in the top box, we would definitely want you to call 911 if there was any chest pain, any obstructed breathing, shortness of breath, seizures, or thoughts of hurting yourself or your baby. Those would be immediate things that we would want you to seek help for. The items in the bottom box that spell out birth would be things that we would want you to call your healthcare provider. But if you can't reach them, don't wait. Go ahead and seek help either through urgent care, an emergency room, or calling 911. And those would be things like bleeding, where you're soaking through one pad an hour, or you've got blood clots that are the size of an egg or bigger. If your incision is not healing, if you've had a C-section, if you have swollen or red legs that are painful to the warmer touch, or they're warm, those were the things that we were talking about with your calf. If your temperature, again, is 100.4 Fahrenheit or higher, and the other one is if you have a headache that does not get better even after taking medication, or you have a bad headache that has vision changes. Any of these things we would want you to seek information, help, advice from your healthcare provider, or head straight to the emergency room. These pictures illustrate different things to think about when you get home from the hospital to help establish healthy habits and establish an adjustment for you as you are learning about your new baby and about changing from being pregnant to your pre-pregnancy state again. So get help. People offer to help. Please take them up on it. Find ways to get sleep. Make sure that you're providing yourself a good nourishment, a good healthy diet, and that you don't forget to nurture your relationship with one another. Sometimes simplifying your life can help with the adjustment in your postpartum period. Choosing easy to prepare meals or making extra so you have leftovers. Some women during the nesting phase will put together some meals that can be put in the freezer that they can then take out and fix later. Or people will bring in food for you, which is also awesome. Limit outside obligations so that you can establish a good routine between you and your partner and the baby. Housework can be a low priority. If you have visitors, hopefully they're willing to help out. Otherwise, it sometimes can be um, imposing for different routines and things that are going on for you. If you have a to-do list, then give them something to do to help out. Make sure that you are spending time with your newborn. That's the most important thing right now, and others can help do some of the other ancillary things. If you want to make sure that you're eating healthy foods, drinking plenty of water, and one of the best pieces of advice that we can give moms is get your sleep and to sleep when your baby sleeps. Things to consider and remember for partners is make time to be alone with your newborn. Find something special that only the two of you can do together. Be confident in your natural ability to parent your child, and find ways that you can establish routines and things that will help in providing a good team approach to doing things around the house. And by all means, if there's feelings of being left out or isolation or um, don't feel like the relationship is where it should be sure that your communication is open between the two of you so that you can discuss that. That concludes the content around labor and delivery and postpartum. If you have any questions or would like to receive any written information regarding these topics, you can do one of two things. You can email rochelle.hazer@allegiant.org, or you can call 402-398-6550, and we'll be glad to answer questions or provide information for you. If you do send an email or you end up getting a voicemail recording, please leave your name, your phone number, and your address if there is information that you would like us to send to your home. Thank you so much, and we hope for the best as you finish up the rest of the pregnancy, and we look forward to taking care of you when you come to the hospital.